Well, one thing we're very concerned about at the moment is around, I think you had a discussion on it earlier, childhood health, particularly in the context of what's happening to vaccination in this country. And across the world, 2 to 3 million lives are saved each year by vaccination. But as part of the fake news movement, actually the sort of vaccination deniers are getting some traction. And so for last year, for example, we saw triple the number of measles cases across England than we had seen the year before, despite the fact that clearly vaccination works. We have seen a 5-year steady decline in the vaccination uptake. And the consequence of this, frankly, is that these are obviously very effective and important health interventions that we have got to continue to win the public argument about. We are not being helped on this front by the fact that although 9 in 10 parents say they support vaccination, half of them say that they have seen fake messages around vaccination on social media. There's been a discussion even this week where I think Instagram has been under discussion, YouTube. And so, frankly, for parents, it's as irresponsible if parents are being told that their children shouldn't be vaccinated as it is to say, don't bother to your kids on their way to primary school looking which way they cross the road. So we have really got to, as a health service, help support parents on this. I mean, in fact, even Mark, in my own daughter's primary school, the WhatsApp. This is probably not something I should be saying, but anyway. Well, I'll just read anonymously. I will read you one of the WhatsApp messages from one of the parents. It's just that, quote, "My kids aren't vulnerable, and I think loading up on vaccines blocks their systems from fighting disease as it should do." So, we've got a responsibility for the 9 out of 10 to really explain that it's not only the interests for your own children, but herd immunity for other children as well. The fact that the MMR uptake at year 5 for 5-year-olds is 87.5% as against the 95% the WHO says it should be is a real problem.